Are you someone that's been trying to grow your hair and have it grow thicker and longer? Well, let me share with you what I have been doing, and I have been seeing a huge difference in my hair. So I have been consuming every single morning collagen powder from Primal Kitchen. I get the chocolate. I also have tried vanilla, and they're both so yummy. There's a ton of other flavors too, but I love chocolate. So every morning I put together some hemp milk, a couple of scoops of the collagen powder. Sometimes I throw in some organic fruit in there. And that's it. That's my breakfast. And my hair has been growing, honestly, almost a little out of control. It's growing so fast. So if you want to check it out, check out their collagen powders. They're amazing and they just taste so good. Head over to Primal Kitchen, PRIMALKITCHEN.com and put in the code Margaret R10 for 10% off of any collagen powder or actually anything on their website. Trust me, you're going to love how fast your hair grows. Welcome to the Sacred Medicine Podcast. My name is Margaret Romero. I'm a Columbia-trained functional medicine nurse practitioner, and here I uncover the truth behind chronic illness so that you can finally heal. I'm a women's health and hormone expert and love empowering women to finally live their life fully and powerfully through optimal health. This is the Sacred Medicine Podcast. Hello and welcome back to another week of Women's Wednesday. I haven't had one of these in a little while, and I was thinking, well, what can we talk about this week? So I'm going to be talking about cardiac health in women and heart disease. So really quick, really simple way of checking to see what your cardiac risk is by getting two lab tests. One is called a homocysteine level, and the other one is CRP, a C-reactive protein test. Now, and the C-reactive protein should be highly specific, so there should be like an HS after it. It's a way better test than just a regular CRP, so just keep that in mind. So let's just start with the homocysteine level. Typically, when these are elevated, the reason why this is such a cardiac risk is because it actually can make blood clot easier. So increasing your risk of clotting either in the lungs, called pulmonary embolism, in the brain, obviously a stroke, or in the heart, creating a heart attack. So we don't want an elevated homocysteine level, obviously. Now, my cutoff is 10. So anything over 10 for me is considered elevated, 10 or 11 or so. So next time you're at your doctor's, definitely have this test done to see what your cardiac risk factors. Now, I typically start checking this in women around, I'd say early to mid 30s. I start checking these two cardiac risk factors because they're somewhat easy to reverse. And you want to know what your risk factor is and how you're doing. So homocysteine also indicates that there is a deficiency in B vitamins when that number is elevated. Now, typically that includes B6, B12, folate. So if the number of homocysteine is over 10, over 11, 12, and higher, that means that your body is just not having or consuming enough folate and B vitamins. Now, another reason why homocysteine level could be elevated is because of low levels of thyroid hormone, kidney disease, and it's also hereditary. So keep that in mind. I do want to point out that if you do want to start on like a B complex or folic acid ever, you really need to have another test done. It's a genetic test called MTHFR. And this test will tell us if you have a genetic issue that doesn't allow you to convert or have the active forms. You actually will need active forms of folic acid and B12 vitamins, which means if you take regular folic acid, regular B vitamins that are not methylated, because your body, if you have the genetic SNP, it's called a single nucleotide polymorphism. If you have this little defect in your gene, which about 50% of the population does, and so do I, then you just need to make sure that you're taking methylated versions of B vitamins. Whenever you do start on methylated B vitamins, you really need to make sure that you're not taking like huge doses in the very beginning, because sometimes with some people it can cause a little bit of anxiousness. So you just want to be mindful of that. Okay, so you want to really start low with that. So homocysteine, first test to get drawn, see what your levels are. You can reverse this with some folic acid. Exercise also helps. And it may also be when people are vegetarians or vegans and they don't consume beef or any form of dairy products. Sometimes they could be really deficient in this and low in their B vitamins. So keep that in mind if you are a vegetarian or a vegan. Okay, next test is, like I said, the CRP, C-reactive protein. Early to mid 30s, I start testing women with this because I want to get an idea of where the levels are and if they are at high risk for any sort of cardiac events. And CRP tests for inflammation, and it can be elevated when there's not only inflammation, but there's also an infection present. So infections, sort of urinary tract infections, inflammatory bowel disease, cancer, rheumatoid arthritis, things like that, it could be elevated. So if you ever get something back like this that's very elevated, I did have a patient a couple years ago that had extremely elevated CRP, and she ended up having pericarditis. So it is a really good test to do to also check for inflammation. And if it's super high, then you've got something going on and you need to get further testing. It's your primary. If you're not already seeing your primary, you need to investigate and figure out why. Now, another reason why CRP could be elevated is also viral infections. But with bacterial infections, those increase a lot higher than in viral infections. So one of the things you can do, if it is elevated, we try to find out the source of inflammation. There's so many different reasons why people have inflammation to begin with. And sometimes it's food allergies. Sometimes they're pathogens in your gut, parasites, some type of pathogenic bacteria. There's viruses, yeast, and parasites, worms. So there's so many things. All of those things can cause inflammation. So we want to be able to figure out what's causing the inflammation, make sure there's no major bacterial infection happening. And if there isn't, then you also want to make sure, and if it's sort of borderline, you want to also make sure to remove things that may be causing inflammation in their bodies, or removing certain foods such as gluten or dairy, which are pro-inflammatory. The other thing that you can consider doing is getting on some fish oils that helps with inflammation as well. And let's see. There sometimes needs to be a little bit of a further workup if the CRP is elevated. So don't forget that when you get this done, make sure it's the CRP-HS. HS stands for high sensitivity. It's a way better test, and that's pretty much it. So those two tests show and can tell you if you have any sort of cardiac risk factors, and if you have a family history, these tests are really important to be done. I definitely start testing my female patients in their 30s, and for men, absolutely, you want to start them in their early 30s as well. I wouldn't wait until they're 50 to do this. I think that's a little too late. If there is inflammation, you really want to know what they are in the beginning. And even for homocysteine, it's as simple sometimes as taking a supplementation. So, and don't forget about the MTHFR test as well. It's a genetic test that could be done through blood work. Just ask your doctor to get that done. And if that comes back positive, make sure you're taking methylated versions of folate, methylated versions of B12. And that's it for this week. Hope that was helpful. And I will talk to you all in a couple of weeks for another Women's Wednesday. Bye for now.